Good afternoon and welcome to Virtual Path Day on October 28th. And we are here to meet the program within the Health and Health Administration path. Specifically, we're going to be looking at the Histotechnician program. And we are going to start with a video about the field, as I know a number of you had questions regarding histotechnology. And then we will join Maddie Josephs from the Department Chair of Allied Health, and who also teaches in related programs. She'll be available to answer any of your questions. So first, we begin with a video.
Hi, my name is Lisa, and I work in a histopathology lab. Today, I'm going to tell you about histotechnology and why it's such an exciting career. Histologists have an interest in science and enjoy hands-on work. They like to work as part of a committed team of healthcare professionals. They provide information that can help doctors determine the best patient treatment. Just think, that person could be you. Let's start by telling you what histotechnology is. It's the study of tissue. Have you ever had surgery to have your tonsils or appendix removed? If you have, then chances are your tissue was sent to the lab where a histologist prepared the tissue for examination. Here, the histologist prepares a tiny section of the tonsil or appendix to be examined under a microscope by a doctor called a pathologist. The main reason tissue is studied is so patients can get a diagnosis and physicians can prescribe the best treatment. But that's not all. Histologists can also provide important information on how well a drug or a treatment works to help patients recover. Not only helping that patient today, but patients in the future.
The histotechnologist is absolutely an integral part of the patient team. As a pathologist, I rely on the histotechnologist every single day. We are in close contact all the time. Their skills are very much needed to provide good quality slides, special studies, in order that we make the correct diagnosis for the patient.
Histologists assist with the examination and dissection of most tissues that are removed during surgery. Blocks of tissue are cut into slices thinner than a piece of paper on an instrument called a microtome. The thin tissue sections are placed on a slide and stained with dyes to make the cell details visible through a microscope. Pathologists examine the tissue sections to decide if the tissue is abnormal. Is there a disease present, or is it just an infection? This information is reported to the surgeon, who then plans the care and treatment of the patient.
So in order for us to make our diagnosis by looking at tissue under the microscope, we are reliant on the skills of a histotechnologist to take the tissue from what we would see coming out of the patient, then transforming that into the glass slide that we look at under the microscope. So it's really that skill that helps us to see all the particular features of the tissue that we need to see in order to come up with that diagnosis and then help the patient.
I love my job as a histotechnician because I know that everything I do, I'm contributing to the quality of life of each patient.
What I found interesting in the field of histology was that although you're working kind of in the, in the back scenes of histology, you don't ever get to interact with the patient, but still your job has such a big influence on their lives and their diagnosis.
Histology is a quickly growing profession where histologists are in high demand all over the country. Opportunities are very diverse and continue to expand into more complex testing, including molecular and DNA technologies. Histologists can be found in research labs and in pharmaceutical companies. They can become teachers, educating the next generation of histologists. They can work within veterinary and marine biology laboratories. They can even work with forensic pathology labs.
Each study that I do will determine the patient's possible diagnosis, which could determine what path they go down for treatment. So it's my responsibility to do the highest quality work so that they have the best possible treatment for them.
So what does it take to become a histologist? Are you interested in biology, chemistry, math? Do you like computers? Are you a problem solver and like to be challenged? Do you want to make a difference in patient care? You need to prepare by getting a solid foundation in general science. Histology allows you the freedom to choose the path that's right for you. To be a histotechnician, you will need an associate's degree and completion of an accredited histology program. If you go on to complete your bachelor's degree with appropriate experience, you can become a histotechnologist. Once you have completed your educational requirements, you are eligible to take a national certifying exam that demonstrates you can perform high-quality laboratory tests. Are you ready for the challenges and rewards of histology? To help manage how patients are treated? To be a valuable member of the patient care team? I hope you are interested and will take the next step. Information about training programs and educational requirements can be found at the National Society for Histotechnology's website at www.nsh.org.
Okay. So that's more about histotechnology as a profession and as a field. And it is one of the many healthcare career fields that CCRI can help prepare you for. Dr. Josephs, I'd like to introduce Professor Josephs, who is the Department Chair of Allied Health and can answer any questions about any of the allied health programs and specifically histotechnology. Thanks for being with us, Professor.
You're very welcome, and welcome back to some of the folks that were with us earlier today. First of all, does anybody have any questions on the video that you just saw? Please go ahead and unmute yourself, or please feel free to put a comment in the chat at the bottom. I'll be happy to take any questions.
I know a question I have in watching this video is, do histotechnologists prepare the slides and prepare the imaging? Do they actually read the results as well?
Well, they prepare. What happens is that they take that tissue from biopsy, or again, anything that comes out of the body, right? And they do something called grossing, which they describe it, and then they process it and they embed it in the wax in the right orientation, and then they cut it, they mount it, and they stain it. They do have to look at it to ensure that it is of good quality, because the pathologist who is actually making the interpretation needs a good quality slide to be able to make a determination of normal tissue versus abnormal tissue. And so yeah, they do look at it, and they after some time, they're very good at making that interpretation. I know that they'll know when tissues are abnormal and maybe give a heads up to a pathologist to say, you need to look at this right away. One thing that the video did not discuss is that, and I know this, several of my graduates are involved in this, is that they assisted autopsy. So they excuse me, when you're doing an autopsy, you have to take tissues from all different areas anatomically. And they're very, very involved, very much hands-on in that process as well.
Well, it's very interesting. I hadn't even thought about the fact that this would be in hospitals, for living patients, for treatment, but then also for, case making for causes of death and for things that may be contagious, or just figuring out what has happened with the person as well.
Exactly. And of course, in forensics as well. So some of my students go ahead to work in public health laboratories and in the offices of the medical examiner, because they need to do that kind of testing there as well.
Very cool. So Annie, Martha, Melissa, any questions from you about histotechnology or any of the other allied health programs? And I'm just going to share my screen real quick, and we can get a a good idea of what the other programs in the areas are. So what you're looking at right now is from the ccri.edu/pathways page, and I'm in the Health and Health Administration path. And these are the programs that CCRI offers. And many of them fall under allied health, though not all of them. And you can explore the path with a short course sequence before you choose an area, but it is important to choose one as soon as possible to make sure that you're taking the right courses and getting the right credits towards what you want to do. And you can look at this, and it's split into career degrees and certificates, which are programs that are designed to get you out into the workforce after your time at CCRI. And there is also information on our URI and RIC transfer agreements within health and health administration as well.
I should mention that many of our programs, including histotechnology and including medical art technology, while this is an associate's, a 2-year Associates of Applied Science degree, many of these also have a bachelor degree option, and our students can articulate very easily into other programs to earn their bachelor's degree.
Any questions from our students?
Be sure to look at the site and be sure to look at the statistics from the United States Bureau of Labor Statistics. And when you put in any one of these professions that you see here, you'll see what vacancies are like and what starting pay is like, particularly in the Northeast. And that might be very helpful too in helping you to make that determination. For example, there's clinical laboratory technologists and technicians. Their starting pay with a bachelor's degree is $43,000. It's just a little bit less than that with an associate's degree. And it says typical entry-level education. I can assure you that there are many of my graduates out there with associate's degrees who are doing just fine. But again, you can look at state and area and regional data that helps you to see what it looks like. Jess, you're on mute. If you're talking, I can't hear you.
Thank you for that.
Okay.
I've been pretty good all day, but one's going to catch me eventually.
Yeah.
I just want to thank Professor Josephs for being here with us today. And if you have any questions in the future, you can certainly contact Professor Josephs and any of the professors from the department and from Allied Health, any of the areas through the web pages. So ccri.edu/pathways will get you to the Pathways page. And Professor Josephs, would you be kind enough to share your email address again?
Sure, it is mjosephs. So MJOSEPHS, there's an S at the end there, at ccri.edu.
And just before we go, Annie, I saw you come off mute. Do you have a question? That's all right. You can always email Professor Josephs as well.
Yep, absolutely.
All right. Well, thank you very much for being with us today, and thank you for attending. And I hope everyone has a great day.
Oh, Melissa, did you have something?
Yes, thank you so much for noticing. I enjoyed the, can you hear me?
Yes.
Okay, I enjoyed the interview session with the pathologist, and I wondered, in a hospital situation, is a histo typically working directly one-on-one with a pathologist regularly, or will they work with several different professionals in that setting, or is it really diverse?
So it's going to depend on how big the institution is, but certainly all of our hospitals here in Rhode Island have more than one pathologist on staff. And so the histotechs do work in conjunction with these physicians. Pathologists are MDs. And so the histotechs do work in conjunction with them on a daily basis. Your work is very much integrated.
Thank you.
You're welcome.
And Annie, how about you?
I don't have any questions at all. Thank you.
Oh, okay.
Yeah.
Just wanted to make sure we answered any that any might have.
Okay, thank you.
Thank you very much. All right.
Well, thank you all for joining. And again, please feel free to reach out to me. And as I told the group earlier today, if I don't have the answer, I will point you to the right direction.
Right. Thank you again for coming. And thank you again to Professor Josephs for joining us today.
Thank you, Jessica.
Take care.
Okay, have a good day.